Dr. Miguel, welcome again, Turkey.
Thank you very much.
Doctor, veterinarians often struggle to ask silence for payment.
Yeah.
What should we correct by a timing to reduce payment? Why important this question?
Yeah, well, payment is necessary, although painful to ask for it, but it's necessary because we make a living out of our profession. So timing, well, you know, in the veterinary consultations, there are like 7 steps. But in order to make it short, we need to initiate the consultation, creating a good relationship. We need to know what are the main concerns of the client. We need to ask for them. We need to do the physical exam. And only then is the moment to explain what we have found, in what way it connects with our client concerns. And then, when proposing options, diagnostic options, or treatment options, it's the time to talk about money. Because every single option, every single treatment comes with a cost. But first, we need to explain why are we choosing those options, in what way are they going to benefit the patient. And then, because at the end of the day, someone is going to pay for that, we need to very openly explain the costs.
Sure. What are the key points in communication between veterinarians and pet owners?
Yeah. That's a very good question.
Yes, a very important communication.
Yeah.
Is now a big problem for me.
Yeah.
I think.
You know, for me, the main problem is the mindset. We have been taught with a paternalistic approach. So a very common approach is, I am the doctor, I am the expert, listen and shut up.
Yeah, of course.
And do as I want you to do. But nowadays it's not working. And what we see that it is working in human medicine, veterinary medicine, is a more open approach. Like, I am the expert in medicine, and you are the expert in what? In your values, the money you can afford, the relationship you have chosen to live with your pets, your family, your context. Now we have a common ground, which is the pet. You as an expert tell me, how are you living the situation? I am an expert in medicine. Let me guide you through the best options in medicine for the pet. So it's using the, maybe using is not the right word, but I guess everybody's going to understand this, is using the client as a partner, as a resource, and not as an enemy, because we want the best for the family, for the pet.
Yeah.
So partnership, that's the mindset that we need to change in communication.
It's a big problem again.
It's a big challenge, but a great opportunity.
What strategies do pet owners find most uncomfortable or disturbing in veterinary clinics?
Well, there are many studies saying, or trying to find what do clients really want and what they don't want. And well, I've been sharing with our Turkish colleagues this data in a series of studies by the American Animal Hospital Association. 93% of clients, they want veterinarians to tell them all the options, even if they cannot afford them. So clients want all the options. They don't want unwanted surprises. They don't want surprises, especially regarding money or the outcome of a treatment. And what is happening? That many veterinarians are not offering all the options because they think that the owner or the client is not going to pay for that or hasn't got the money.
Yeah.
But that's a prejudgment, and in many cases it's completely wrong. And we know that clients want, they don't want surprises. But you know what? In a series of studies, in less than 30% of the consultations that were videotaped, costs was part of the conversation. So because we feel uncomfortable and we don't know how to do it. And because clients also don't know if it's right or not, talk about money, money is not part of the discussion. And then there are unwanted surprises. And you know what? When this happens, complaints, false expectations, clients leaving, veterinarians frustrated, chronic stress, and then burnout, and unfortunately, many veterinarians, especially young veterinarians, leaving the profession. And the root for this, communication.
Yes. In key point, communication.
Yeah.
Last question for Klivet Congress. What do you think? Are you happy to be here?
In Turkey?
Yeah. In Klivet.
This is my third time.
Yes.
I'm more than happy because you know what? The first time, it was amazing. I can remember that I was super nervous because it was one of my first lectures abroad, but I felt so good. So I felt like embraced by my Turkish colleagues. Then the second one, just before the pandemic, 1 or 2 couples of weeks before the pandemic.
Yes.
And it was so good that this time, when I came here, something like 5-6 years afterwards, I met many good friends like Ebru, and wow! And the first thing we did is hugging each other. So yes, I feel very good. And then, what I can tell you, yesterday, not only during the lectures, but especially in the workshop. You know, workshops are more. There's more intimacy in this workshop. We had a lot of fun, and we had very open discussions. I got to know better the profession, how things are going in Turkey. So I feel super happy.
Yes. Last question, and last question for me now.
Yeah.
What is your dream in 20 years late?
My dream?
Yes. For communication, for payment. What do you think?
You know what? I will tell you with a very short story. When I opened my clinic, my focus was only medicine, surgery. And in some way, it was good. It was what I needed to do. But then, thanks to the kind of medicine that I was doing, so I went to Holland, I went to England, I went to some places to try to become a better doctor. But then, my clinic grew from 2 to 20 people. And in that journey, I started to feel the pain, a lot of pain, because I didn't know what to do as a leader. I was not prepared, trained. I was not ready to be the boss of 20 colleagues. And I struggled. If that was success, and I can tell you it was a very successful clinic, but if that is success, I don't know how high it's going to be. So it was then that I started to try to find ways to enjoy the profession again. And, trying to find something, I found coaching. I started to do coaching in my hospital. And then, because coaching was working, companies started to ask me, please, Miguel, could you tell us what are you doing in your hospital? And then I became a professional coach. And then I began to lecture in Spain and abroad. And then I sold my hospital to my team. Because thanks to coaching, they were more than ready to lead the hospital. So my vision, my dream, is to help veterinarians to try to avoid them the pain that I went through and the pain that my team went through because of my lack of leadership, and to help them to enjoy our beautiful profession, but balancing the science, the medical part, and the communication part and the leadership part, because in the balance between both, that's the magic. We need both.
Thank you for coming again.
Thank you.
Thank you very much, Doctor. Thank you.